FOOSH. A kid falls from a swing, lands on an outstretched arm, and his elbow is swollen and he has a weak radial pulse. And that's going to be the clue. Supracondylar humerus fractures are the most common elbow injuries in kids, and they have a real danger because if the proximal fragment shifts anteromedially, then it can actually crush the brachial artery and the median nerve, right where they pass in front of the elbow. And that means ischemic risks and motor and sensory loss in the lateral hand. And yes, this is a big emergency. It's the FOOSH. So anterior medial displacement of the humeral fragment puts the brachial artery and the median nerve at risk. Common in children after falling on the outstretched hand, FOOSH. Anterior structures are at risk for hyperextensive type supracondylar fracture. Your brachial artery causes a lower or decreased radial pulse or a cold hand. Median nerve is the motor and sensory defects in the lateral hand. So the anterolateral displacement would be your radial nerve, and your median nerve damage at the elbow. Thumb opposition would be caused to be decreased by your median nerve damage, and also your flexion of your digits 2 and 3. So you'll have some sensory loss as well over your lateral palm. Okay, so an 8-year-old boy trips, falls while running. His arm is swollen, painful after he braces himself on the fall. X-ray shows a supracondylar fracture with anterior medial displacement. What structure is at risk for injury? It's going to be your median nerve. Median nerve and the brachial artery are in danger. Median nerve palsy manifests as a hand grip weakness, altered sensation in 1 to 3. Ulnar, posterior to your medial epicondyle, that'd be your flexion injuries. Radial, lateral, that's at risk for anterior lateral displacement. Subclavian is way too proximal. Axillary is the shoulder region. So here are the 3 steps. Never miss a question like this again. 1, anterior medial displacement of the fracture indicates potential injury to the median nerve. 2, diminished radial pulse suggests vascular compromise. So that means the brachial artery is damaged. 3, clinical presentation aligns with median nerve because you have sensory loss over the palmar aspect of the first 3 digits, and that's how you know that it's median. If this is helpful, then like and subscribe. See you in the next vid.